Thank you very much. Following on immediately from the previous talk, one of the consequences of hearing voices, consequence of experiencing depression, consequence of experiencing many mental health problems is a difficulty with social relationships, a difficulty with engaging with your family, with your friends, with the wider community, with the world of work. So this leads to a loss of social networks, a loss of people around who can provide support, information, advice, companionship, the things which many of us take for granted day in, day out. Now, mental health services are charged with supporting the recovery of people with severe mental health problems. And recovery means a number of different things to different people. It can mean the absence of symptoms, or it can mean recovering your life. And part of that, recovering your life, a process of social recovery, if you like, is about re-establishing relationships, re-establishing networks, connecting with people again, following a period of ill health. So what we're trying to do in our research group is to establish an evidence base for practitioners supporting people to engage with new people or to re-establish their relationships. In mental health services, we have a very poor evidence base for social interventions, largely because social work and social care practice is complex. It involves a number of variables. It's to do with human relationships, which are inevitably and inherently complex. So the first stage of our research was to model some of the complexity so it could be replicated, so that we can train people what is required in this area of practice. And this is an example of some of the complexity that is involved in this work. I've only got 7 minutes, not 7 hours, unfortunately, to explain this to you. But this illustrates some of the processes which are going on when a worker is supporting somebody to engage quite simply with new activities in order that new networks may emerge as a result of that process. May not, but it is hoped that they do. And the process acknowledges barriers, it acknowledges the role of the agency, but it also acknowledges that the worker themselves is on a journey of discovery. It's not a doing to intervention, it's very much a doing with intervention. So once we were able to model the complexity that is involved in this work, we were able to develop some training, some guidance for staff, and evaluate that. And following a pilot study, we evaluated this model, found that where it was implemented well, outcomes improved. And the primary outcome was access to resources within your network, that people's networks became more resourceful as a result of practice that looked a bit like that model. And we're now at the stage of challenging mental health services to take this on board in an implementation study, looking at whether or not social workers in particular, but other members of the MDT, occupational therapists in particular, work in this way as well, can improve outcomes by embedding this model within their routine practice. So we're looking to see, can high fidelity be achieved? Can outcomes be improved in a non-randomized controlled study? At the moment, we are just at the early stages of putting together an implementation toolkit before we launch it in practice. But at the same time, we're working on another study, which is a 5.5-year project working with many sites around the country. It's led by colleagues in East London, focusing around enhancing the social networks of people who have experienced psychosis. And the model, the underpinning framework of the model is very, very similar, although we're coming at it from slightly different angles. But again, we're leading to a trial, leading to develop the evidence base in this field. And at the moment, we're undertaking a survey. But just a nod really to our international work and how this is being extended internationally. You'll see on the front cover of the book, which you can pick up outside, some of our work in Sierra Leone, where we have taken some of these ideas and gone through a cultural adaptation process in trying to see whether the ideas could make sense and then develop indigenous models. So we've been successful in Sierra Leone in doing that, and we're now in Nepal doing a small project with the Freedom Fund, who are working with people who are in bonded labour, where there's intergenerational debt. People are effectively in slavery with employers. Inevitably, it's a major source of psychological distress, and the Freedom Fund find it challenging to import Western counselling models. So we've been working with them to develop a social-based model in terms of community engagement, working around the idea of networks and what other people can do to provide support. It's required some cultural adaptation work, some training work, some co-facilitation, and we're in the process of evaluating outcomes at the moment. That's a very brief insight into some of this work. Thank you.